Every year, thousands undergo cardiac surgery, and nearly one-third face the challenge of atrial fibrillation, or AFib, post-operation. AFib is the most common arrhythmia worldwide, posing significant health risks and increasing patient costs. Traditional approaches often fall short in preventing this complication. But what if there was a simple, cost-effective solution? Enter potassium supplementation. Recent studies reveal that maintaining a lower threshold for potassium levels post-surgery can significantly reduce the risk of AFib without introducing additional dysrhythmias. Potassium, a vital electrolyte, plays a crucial role in maintaining cardiac health by stabilizing heart rhythms. Incorporating potassium supplements into post-operative care not only enhances patient outcomes, but also offers substantial cost savings. Healthcare professionals and policymakers are now considering this approach as a standard practice to improve recovery rates and reduce hospital stays. Expert cardiologists emphasize the importance of potassium in the recovery process, highlighting its benefits in patient testimonials. These real-world experiences underscore the transformative impact of this simple intervention. As we continue to explore innovative solutions in cardiac care, potassium supplementation stands out as a promising strategy to combat AFib post-surgery. By prioritizing this approach, we can pave the way for healthier recoveries and more efficient healthcare systems. Join us in embracing this breakthrough in cardiac health management, ensuring every patient receives the best possible care after heart surgery. Together, let's make AFib a challenge of the past.
In the realm of cardiac health, atrial fibrillation, or AFib, stands as a formidable challenge, particularly after heart surgery. Affecting nearly one-third of the 1.5 million cardiac surgeries performed annually worldwide, AFib is the most common clinical arrhythmia, impacting up to 3% of the Western population over the age of 20. But what if a simple adjustment in potassium supplementation could significantly reduce this risk? Traditionally, patients receive intravenous potassium supplementation if their levels fall below 4.5 millimamp per liter post-surgery. However, a groundbreaking study published in JAMA Network suggests a paradigm shift. Conducted across 23 cardiac surgical centers in the UK and Germany, this randomized clinical trial involved 1,690 patients undergoing coronary artery bypass grafting. The findings reveal that maintaining potassium levels only above 3.6 millimEq per liter is non-inferior to the standard practice, potentially lowering the risk of AFib without compromising patient safety. Consider the case of John, a 65-year-old patient with no history of atrial dysrhythmias who underwent heart surgery. Under the new protocol, his potassium levels were managed to stay above 3.6 millimEq. Post-surgery, John experienced a smoother recovery with no signs of AFib, highlighting the study's practical implications. The impact of these findings could be profound. By adopting this new potassium threshold, healthcare professionals can potentially reduce the incidence of AFib, leading to shorter hospital stays, lower healthcare costs, and improved patient outcomes. This approach not only challenges the current standard, but also aligns with the overarching goal of enhancing cardiac care. AFib, characterized by irregular electrical activity in the heart's atria and ventricles, can lead to rapid heart rates and inefficient blood circulation, increasing the risk of clots. Factors such as advanced age, high blood pressure, and underlying heart conditions contribute to its development. Yet, with this new insight into potassium management, we have a promising tool to combat this postoperative complication. As we continue to explore and implement these findings, the potential to transform patient care is immense. By focusing on individual patient stories like John's, we can empathize with the human aspect of these medical advancements, driving us to adopt practices that prioritize patient well-being. In conclusion, this study not only offers a viable solution to a prevalent problem, but also underscores the importance of ongoing research in improving healthcare practices. As healthcare professionals and researchers, embracing these findings could be a pivotal step towards reducing the burden of atrial fibrillation and enhancing the quality of life for countless patients. In the ever-evolving landscape of healthcare, potassium supplementation standards have long been a topic of debate. Today, we delve into the impact of these standards on patient outcomes and healthcare costs. Traditionally, stringent potassium levels were maintained to prevent heart dysrhythmias. However, recent studies suggest a shift might be beneficial. Our focus is on a groundbreaking study involving 843 patients under a relaxed potassium supplementation standard. The results are compelling. Contrary to concerns, this relaxed approach did not lead to an increase in heart dysrhythmias or other adverse developments. In fact, it opened the door to significant cost savings. The data reveals a mean cost saving of $111.89 per patient in the relaxed group. This finding not only challenges the status quo, but also highlights the potential for improved healthcare efficiency. By easing supplementation thresholds, we can maintain patient safety while alleviating financial burdens on healthcare systems. Visuals of patient data and cost analysis charts underscore these findings, painting a clear picture of the benefits. As healthcare professionals, researchers, and policymakers, these insights urge us to reconsider our approaches. In conclusion, the relaxed potassium supplementation standard offers a promising path forward, balancing patient care with economic prudence. As we continue to explore and adapt, the ultimate goal remains clear: enhancing patient outcomes while optimizing healthcare resources. Thank you for joining us in this exploration of innovation and efficiency in healthcare. Welcome to our educational journey on the vital role potassium plays in heart health. Today we'll explore how this essential electrolyte impacts cardiovascular function and why maintaining the right balance is crucial for your heart. Potassium is more than just a mineral. It's a key player in the electrical signaling of your heart. As Dr. Paul Drury, a board-certified cardiologist, explains, potassium travels in and out of cardiac cells with every heartbeat. This movement is essential for maintaining a steady heart rhythm. When potassium levels drop too low, the risk of arrhythmias, including life-threatening conditions like ventricular fibrillation and atrial fibrillation, increases significantly. On the flip side, excessively high potassium levels can slow your heart rate dangerously, potentially leading to heart block, a condition that can be fatal. So, what is the optimal potassium level for heart health? According to Dr. Drury, maintaining a potassium level between 3.6 and 5.5 mg/dl is ideal for cardiovascular health. This range helps ensure that your heart's electrical system functions smoothly, reducing the risk of arrhythmias. Dr. Shefal Doshi, another expert in cardiac electrophysiology, adds that potassium, along with other electrolytes like calcium, sodium, and magnesium, plays a crucial role in the electrical functions of cardiac cells. The normal range of potassium, typically between 3.5 and 4.5 milliliters, reflects a stable environment within these cells. However, it's important to note that even within this range, extremes can lead to electrical instability, particularly on the lower end. This instability can make cardiac atrial cells more susceptible to fibrillation. Understanding the balance of potassium is essential for anyone interested in heart health. Whether you're a medical professional, a health enthusiast, or someone simply looking to maintain a healthy heart, knowing the risks associated with potassium imbalances can empower you to make informed decisions about your diet and lifestyle. In conclusion, potassium is a critical component of heart health, influencing everything from heart rhythm to overall cardiovascular stability. By maintaining optimal potassium levels, you can support your heart's electrical functions and reduce the risk of serious arrhythmias. Thank you for joining us on this educational journey. Stay informed, stay healthy, and remember, your heart's health is in your hands. For more insights and expert advice, don't forget to subscribe to our channel and visit our health website. Until next time, take care of your heart.
Welcome to our exploration of atrial fibrillation, or AFib, a condition that affects millions worldwide. Today, we delve into the risk factors that contribute to this heart rhythm disorder, helping you understand who is most at risk and why. Atrial fibrillation can occur at any age, but it is predominantly seen in older adults. As we journey through life, various factors can increase our risk. Let's start with hypertension. Long-term high blood pressure is a significant contributor, placing undue strain on the heart. Next, we have pulmonary embolism, a serious condition where a blood clot blocks an artery in the lungs, increasing the risk of AFib. Heart disease also plays a crucial role. Conditions like heart valve disease, heart failure, coronary artery disease, and past heart attacks can all elevate the risk. Alcohol consumption is another factor. While heavy drinking is a well-known trigger, even moderate alcohol intake can lead to AFib in some individuals. Similarly, the use of certain drugs, such as methamphetamine, can also be a catalyst. Family history cannot be overlooked. If your family members have experienced AFib, your likelihood of developing it increases. Sleep apnea, particularly severe cases, is another risk factor that can exacerbate AFib. Chronic conditions such as thyroid disorders, asthma, diabetes, and obesity further add to the risk. It's important to manage these conditions effectively to reduce your chances of developing AFib. For those who have already experienced AFib, the risk of recurrence is high. Other factors, such as a history of congestive heart failure and cardiomyopathy, also contribute significantly. Maintaining electrolyte balance, especially keeping potassium levels in the high normal range, is crucial as low levels have been linked to increased AFib risk. As we age, the cumulative impact of these risk factors becomes more pronounced. Early intervention and proactive management of these conditions are key to reducing the risk of atrial fibrillation. Remember, understanding these risk factors is the first step in managing your heart health. Stay informed, consult with healthcare professionals, and take charge of your health journey. Thank you for joining us in this exploration of atrial fibrillation risk factors. Stay healthy and informed.
Welcome to our exploration of potassium's vital role in heart health. Potassium, a key electrolyte, is essential for maintaining the electrical balance that keeps our hearts beating steadily. As Dr. Paul Drury, a board-certified cardiologist, explains, potassium travels in and out of cardiac cells with every heartbeat, playing a crucial role in cardiovascular function. But what happens when potassium levels deviate from the norm? When potassium levels drop too low, the risk of arrhythmias, such as life-threatening ventricular fibrillation and atrial fibrillation, increases significantly. On the flip side, excessively high potassium levels can lead to dangerously slow heart rates and a condition known as heart block, both of which can be fatal. The optimal potassium level for cardiovascular health is between 3.6 and 5.5 mSv/liter. This range ensures that the heart's electrical system functions smoothly, reducing the risk of complications. Dr. Shepal Doshi, a cardiac electrophysiologist, highlights that while the normal range is broad, maintaining balance is key. Potassium, along with other electrolytes like calcium, sodium, and magnesium, contributes to the electrical stability of cardiac cells. When potassium levels fall below 3.5 mSv/liter, the heart's electrical environment becomes unstable, increasing the likelihood of fibrillation. This instability can lower the resistance of cardiac atrial cells, making them more susceptible to irregular rhythms. Visualize this: a heart beating rhythmically, each beat powered by the precise movement of potassium ions. Now, imagine the chaos when these levels are disrupted. It's like a symphony where one instrument is out of tune, throwing off the entire performance. To maintain heart health, it's crucial to monitor potassium levels and ensure they remain within the optimal range. This balance not only supports the heart's electrical functions, but also safeguards against potential life-threatening conditions. In conclusion, potassium is more than just a dietary mineral. It's a cornerstone of heart health. By understanding and managing our potassium levels, we can take proactive steps towards a healthier heart. Thank you for joining us on this educational journey. Remember, knowledge is power, and in this case, it could be the key to a healthier heart. Stay informed, stay healthy, and keep your heart beating strong.